I call the member for Richmond.
Thank you, Deputy Speaker. And the Albanese Labor Government is absolutely committed to strengthening Medicare, and we've been doing that since day one we've been in government. And of course, this week we saw in the Parliament we introduced legislation for cheaper medicines. And this means a prescription on the pharmaceutical benefits scheme will cost Australians no more than $25 from the 1st of January 2026. And of course, this builds on action we've already taken to deliver cost of living relief through cheaper medicines. Of course, we had the largest cut to the cost of medicines in the history of the PBS, the 60-day prescription saving time and money, and freezing the cost of PBS medicines. And of course, for those pensioners and concession card holders, their scripts of course stay at $7.70 until 2030, a vitally important issue as I have many pensioners and concession card holders in my region. So these cheaper medicines policy, it's another very key cost of living measure that this government has brought in. And of course, for the people of the North Coast, all of our initiatives have made a huge impact upon them when it comes to healthcare, particularly tripling of the bulk billing rates, making MRI scans more affordable, new health services to support those experiencing homelessness, and of course a new headspace in Ballina, which is already opening and providing important services for our younger people. And really importantly, changes to the modified Monash model for the township of Murwillumbah. Deputy Speaker, I've told this House many times the situation there. Of course, under the Morrison government, they actually changed the classification of this wonderful small regional town, Murwillumbah, from regional to metropolitan, which was completely absurd. Of course, it meant that they were unable to bulk bill many people, they couldn't attract many doctors, and the situation was devastating. And I was very, very pleased the Health Minister came to Murwillumbah, met with local doctors, heard first-hand about the impact of this classification. And of course, only a few months ago, it was changed. Murwillumbah is now classified as a regional area again, and very pleased to report that local doctors and local residents there are telling me that bulk billing has increased. We've also now got a lot of doctors that want to move there because the incentives are in place. So again, it's about Labor listening and Labor acting, and for this town in my region, it was a huge improvement when it comes to health services. And of course, during the election, I made those commitments, so we're getting an urgent care clinic in Tweed Heads, which is absolutely important that people can access that and just need their Medicare card to do it, and also a Medicare mental health centre in Tweed Heads, also free and bulk billed. Both those services will be so important for the Tweed and the North Coast region as well. And yet again, it's a Labor government that continues to deliver and strengthen Medicare after so many cuts under the previous government, the rebates frozen, so many cuts to Medicare. It's now the Albanese Labor government delivering for my community and indeed right across